Where is Mary Immaculate Hospital? Does anybody know where that is? Mary Immaculate Hospital?
Queens.
No, it's closed. Used to be in Queens.
Yeah.
Where is North General Hospital?
Closed.
Closed, 123rd Street. Okay, where is Parkway Hospital? Closed, but appropriately named because it's on the Van Wyck Expressway. Okay, closed. Parkway Hospital is closed. Mary Immaculate is closed. North General Hospital is closed. St. Clair's, which is my first job after residency, which had the largest inpatient HIV unit in the city, is closed. Where is St. Vincent's Hospital? Closed. Closed. A hospital that in the center of the West Village and a huge HIV program does not exist. Cabrini Hospital on 19th Street, closed. That is just the last 5 years. That's right, wow. So let's start what the point of this endeavor is. You see, you'll notice that this room is largely empty. Just because people don't think that a problem is not going to affect them doesn't mean that problem's not going to affect them. Or someone else will solve it. Someone else will solve it. You know, I was at North General Hospital the day it was announced that it closed. The residents started their internship on July 1st, and on July 2nd they were told they had 10 days left, and the hospital was closed 10 days later. Yesterday, in my hospital, I'm chief infectious disease at Jamaica Hospital. It's a 4-hospital system, the Medicine system. It's a 4-hospital system because Brookdale went bankrupt, and we were asked to take it over. We took it over. Flushing Hospital was going bankrupt. We were asked to take it over. We took it over. Peninsula Hospital was going bankrupt. We were asked to take it over, and we took it over. Our CEO had the misfortune last year of being, unfortunately, arrested and lost because he was arrested for employing state legislators in jobs that some people considered buying influence. Now, no one can say, and I certainly saw no evidence that said that somebody voted that way because of those jobs or consultancies, etc. But it's an interesting thing in the world that 6 months after all of this big hoo-ha happens, and a guy devotes 40 years of his life to that hospital, not to take $1 of money into his own pocket, but to save his own institution, that for the first time ever, one of those hospitals in the 4-hospital system now is bankrupt and was closed 10 days ago. Peninsula Hospital doesn't exist anymore. And Brookdale has $250 million in debt, and if we don't get out from under it, my hospital will close in 1 year. 10% of the hospital workforce where I'm at today was fired today. My partner, his wife, works in the hospital as a nurse. She was fired today, after being told last week that her job was secure. The guy who was apologizing, saying, I wasn't misrepresenting it. Turns out I'm probably going to be fired next week myself. I volunteered back 1/3 of my salary to save other people's jobs today, and said, I will write books to save the other people that are here. So what do you think it's like here when the person, my title is Director of Educational Development. That's my title. I was hired by the institution. I'm hired by institutions that either are in trouble with their residency, they have citations, they're on probation, going to be on probation, in danger, bad pass rates. Or Jamaica Hospital, when I was hired 2 years ago, said, we're doing so well, we want to expand, we want to start having fellowships. Would you start fellowships for us? We started pulmonary fellowship. I was this close to starting GI, and then our CEO is gone, and now all of a sudden, what kind of world is it where you actually have to employ the politicians in these jobs to stay afloat? What kind of world is that? You understand that? What kind of world is that? I traveled this Tuesday to Albany, and I met with Skelos, who's the who's the State Assembly Chairman of the Health Committee, and a number of other prominent people in the state legislature. And they basically said, we have no plan for hospitals in New York City. We don't know what to do. And then after 7 visits, it became clear to me that finally one guy was honest with me. And they go, hey, Conrad, you think any of us are going to leap forward to help a hospital where 2 of our guys have already gone to jail and 1 guy may go to jail? You think we want to leap out in front and say, I want to help protect your hospital? Well, we understand the problem we're at, but we're not doing it. So if you think that the reason for this meeting is a thought exercise, it's not. Now, on the other hand, just like the pituitary, which is a relatively small number of cells, or the pancreas, which is 2 ounces, and only 2% of the cells are islet cells, a small number of people can control the whole system. So it doesn't really matter if it's a small number of people, so don't be upset, don't be hurt. Don't be hurt, because it doesn't matter. It's always been a small number of people. There's never been, I mean, except for this Joseph Kony thing this last 24 hours, which has been fantastic, which I love, by the way, which I love, okay? It's rare that you have a large number of people changing anything. So I think that's important to start from that this conversation really could be happening. It really could be happening. So let's go down and start like this. Pediatrics is very important. I have 3 kids, 15 and 16-year-old boys, and a 4-month-old baby. I love pediatrics, very important. Except, you know what? Basically, a nurse practitioner can hand out those vaccines. You don't have to be a doctor to do it. The other thing is, if you want to walk around all day long and label out amoxicillin, amoxicillin, amoxicillin all day long, and basically have to deal with irate parents all day long for crappy reimbursements, and be peed on, oh, cute baby, yeah! Oh, very nice. Okay, but you know what it is? You can do that, you can hand out vaccination rates despite the insane people like Jenny McCarthy who should be taken out and beaten with a stick. Vaccination rates are an all-time high, fantastic, okay? All right, gynecology, OBGYN, I love gynecology, and I love the guy who's a gynecologist talking about a panel that's all men, it's fantastic. Okay, okay, excellent. And talking about, okay, and we're all for that, but you know what? On gynecology, the thing is that it's one of those things that, unfortunately, you know, it's one of those things that anybody could do it, but if things go wrong, you want a super expert. I agree with that. But the thing is, I worked in a women's health agency for 2 years, and gynecological nurse practitioners can handle most of that. And in terms of psychiatry, I think there's been tremendous advances in psychiatry. And I love the societal expense of $11 billion in medications for antidepressants that have been shown in almost all but the most severe depression to in fact be no better than placebo. And you know what hospital system distributes the largest amount of psychiatric medications in New York City? It's the hospital called the New York City Department of Corrections. It's the prisons. So, well, you know what? If I was really having a heart attack, would you want the psychiatrist to say, and how do you feel about that? Hurry, let me vaccinate you. Or, well, before you die, you want me to enlarge your breasts or do a collagen injection here? Okay? And my gynecologist come by and say, I can't reach the coronary. I can't reach the left main. I can't get there from here. So the point is, you know what? That's my day. And my day is this. If you're having a heart attack right now, you have basically 3/4 of a less chance of dying than you did 30 years ago. And you know what? Let's say the other part about it like this. You know what? We're in the age of miracles in medicine. And the truth is that we've never been able to do more, heal more, cure more, relieve suffering more. And you know what? Let's switch this. In psychiatry, 40 years ago, there were 600,000 people in inpatient psychiatric facilities in the United States with a population of 150 million, and now there's only 60,000, and that rocks. 90% less people as inpatients. ENT surgery relieved me of certain things inside my nose where I had a bone spur that got chopped off at Lenox Hill, and it made me a whole new man, and it was fantastic, okay? And you know what? You may may want to give birth in a water baby out there in a birthing center out there where you say, I want to give birth in a water baby because this is totally bullshit because every kid wants to get, can I have a breath, please? Can I have a breath? And you want that person there. And when you're worried about your sick child in the middle of the night, you know, I don't care how many books anybody's read or how many books you've written or whether you're an NIH super genius, I want a pediatrician to tell me what to do so I don't freak out. And I'm going to tell you also, we don't have ophthalmology here, but corneal transplants can be done now in 4 minutes, and we have down a blindness rate that is down by 90%, and we have never been doing better. So the big message is this: do I think internal medicine is great? Yes, I do. But you know what I think is great overall? This is the best time ever in the history of the world to be coming out of medical school, and next year, we're going to finally fulfill an American dream that says every human being in this country gets the chance to have health insurance and nobody's left behind, even if I have to pay for it myself in my own hospital. Thank you very much.